Medurstand-Understanding Medicine.
Professor Aziz Rehman, and today I'm going to talk about another very interesting topic. The topic of today, role of artificial intelligence in health. And this topic really fascinates me, and I'm no expert on the topic, but I have gone through the literature and found it very interesting, and I thought we'll share with you. And I hope that after listening to this lecture, many of you would also fall in love with this topic. First of all, the introduction, a few terminologies. For example, what is artificial intelligence? That I'm going to define in the next slide, but artificial intelligence is the word which is going to be used repeatedly. Deep learning, somewhat similar meaning. Large language model, again a term which is used very widely in this context. ChatGPT is a software which was the first one in the series to become publicly available, and this is developed by OpenAI, and there are many such systems developed by other big tech companies like Bard from Google, and there one from Microsoft, and every big tech company have their own artificial intelligence system. AI has increasing significance in various fields. Actually, we have been using AI in a milder form for many years, but now it is coming in its full force and is going to have big impact on everything we do and everything that happens these days. But it has got very good and potential role to revolutionize healthcare, because in healthcare we use a lot of technology, and this is going to make the application of technology much easier and automated. So what is artificial intelligence? It is a simulation of human intelligence. So in the true sense of the word, it is not intelligent. AI, it tries to simulate human intelligence because it can go through extremely vast data very fast and come up with something which is like a response of a human, and it processed by machine, including learning. Of course, learning, memorizing is very easy for machine, but then reasoning, this is a relatively new thing, and self-correction and self-learning. Now, machine can learn from its own experience, and that is actually part of artificial intelligence. But the machine is not conscious. It is not truly intelligent in the actual sense of the word. So comparing human intelligence and artificial intelligence, I have given several points, and let me show you if I give you the comparison. For example, capacity to memorize, retain and recall. Human intelligence, of course, is good, better than all other animals, but artificial intelligence is clearly better than humans because it has got unlimited capacity to memorize, retain and recall. So I think machine wins here. Subjectivity, compassion and empathy, these are the things which we have to apply when it comes to patient and healthcare. Humans are clearly better. The modern machine, the machine which we use these days, they probably are not able to express emotions and compassion and empathy. Maybe with time, machine will learn to do this also. I still feel that emotions and empathy coming from a human would have much bigger effect on patient than coming from the machine. Self-learning, we all learn from our experiences. For example, if we've seen somebody earlier and we meet him next time, we immediately recognize his face because the image of his face is built in our mind. and we can recall and connect the person with that, but machine can also self-learn, and this is the new capacity, new capability of machine. Pattern recognition. Humans can of course recognize pattern very fast, but machine is super fast. For example, machine can go through millions of images in few seconds, and humans cannot do that. And machine can build up a pattern very fast compared to humans. So efficacy, human have limited efficacy, and machine has got almost unlimited efficacy, because machines do not get tired, they do not get sleepy, and they can work at the unlimited capacity. So we can actually expand machine more and more, and the efficiency would also increase. So overall, there are some plus features with human intelligence, particularly empathy and compassion. And when it comes to capacity and the large amount of work, the machine wins. So I believe both will have to work together as a team, and humans taking the lead, but machine assisting the humans. So that way I think we can make best use of this new technology in healthcare. So there are actually numerous possible applications, and important ones are in diagnostics. Every day we are confronted with difficult diagnosis, and therapeutics, research, genetics and personalized medicine, drug discovery, very important, epidemiology and predictive analysis. Virtual health assistant machine can work very efficiently as your assistant, remote monitoring and telemedicine, and application of artificial intelligence in surgery. So these are possible roles of AI, and I'm going to examine some of them in some more detail in subsequent slides. Let's first take diagnostics. AI is being used for early disease detection and diagnosis. And the first field of diagnostics which adopted artificial intelligence is radiology. And half of our investigation, they consist of imaging, ultrasound, CT scan, MRI and other imagings. First application of AI in health, X-ray, CT and MRI pattern recognition. In mammography, machine is not only equivalent to, but actually has exceeded the detection rate as compared to humans, detection rate of breast cancer. And radiologists will still be needed at least for a couple of more decades. There is a possibility that this part of diagnostics is almost completely taken over by machine, because radiology mostly consists of data, and machine is very good at handling large amount of data. At the moment, it can actually help the radiologist. For example, there are 100 different reports which radiology has to go through. Machine can triage and pick up those which have those images which could potentially indicate a serious condition and which would require early intervention by the doctor. So the machine can pull up those cases which are, for example, brain hemorrhage or an abscess like that. So I think in radiology, artificial intelligence is already very established. And artificial intelligence is being used for early disease detection in pathology also. Now, pathology also consists of data. Now, for example, interpretation of slides, biopsy specimen. One tool we almost always use, and that is usually taken as an ultimate confirmatory sign of a particular disease, is biopsy. So, machine can interpret numerous slides very fast. Even rare patterns, rare diseases, rare cancers, machine can interpret very fast, because one human could see only a number of slides or limited number of slides. would have seen only limited number of diseases in his life, but machine would have seen all the slides and all rarest possible diseases. So machine will be much faster to pick up certain disease patterns and can give you a diagnosis based on biopsy. Another role of diagnostics is in disease detection. Like for example, there are many patterns of skin diseases. Psoriasis is one example. Psoriasis could take many patterns. Now I've seen many patients of psoriasis, and still there are cases who are very odd looking, but ultimately they turn out to be psoriasis. So machine have seen many more patterns of psoriasis, so machine would have no difficulty in detecting this diagnosis, I think better than humans. Diabetic retinopathy, again, not only diabetic but other types of retinopathies like hypertensive retinopathy, a AI enabled retinal camera can pick up diabetic retinopathy in less than 5 minutes without dilating pupils. Human would take, I think, at least 15 minutes for the examination of retina, make a map, and before that another 10-15 minutes to dilate pupil. So I think 30 minutes of valuable human time, the work will be done by a machine in just 5 minutes. So I think diabetic retinopathy can be very early with diagnosed by machine very early. Another area of diagnostics is arrhythmia detection and diagnosis of ischemic heart disease. Now, there are some devices, these smart watches, they have software which can detect arrhythmias, for example, atrial fibrillation or any other type of potentially serious arrhythmia, supraventricular tachycardia, that can alert the patient immediately, not only patient, the doctor, the healthcare facility, and the ambulance service, all can be alerted, and the person who is prone to develop these arrhythmias, that person can wear this device and the doctor will immediately know, and instructions can be passed to the patient himself about the next step. A remote monitoring, suppose we are managing the catastrophes, the floods and the earthquakes, and the patient can be monitored there, and information can be sent back to the large hospital, and appropriate instructions can be taken and implemented. Another one is genetic testing. You know, almost all diseases, or many diseases at least, they have genetic basis, and every person has got unique genetic background. We all look similar. We all have two eyes, one nose, one mouth, same features, but actually when we go to genetics and we go to the detailed genetic studies, every human is different. So there is a possibility that based on that information, the treatment for the same disease may be different in two persons. And this could be based on genomic analysis. Everybody would have this genetic profiling, and the prescription will be accordingly personalized. Next step after diagnostics is therapeutics, and mostly our medicine consists of diagnostic and therapeutics. So second most important area of clinical medicine, therapeutics. Let's see if the AI has some role in this area. So genomic and microbiomic profiling, you know, like everybody has got different genome. In fact, microbiomic profiling is even more important because we are very unique as far as our microbiota is concerned, and we know that there is more and more evidence that many diseases which are apparently related to brain or metabolism, they are actually ultimately linked to our microbiota. So by doing metabolic profiling and genetic profiling and microbiomic profiling, a very customized treatment may be offered to a person. So early detection and intervention in critical care centers settings also. Like for example, patient with shock, patient with burns, patient with sepsis, they have certain trends. Machine can foresee a more serious complication coming by studying the trend. So before that complication actually developed, machine can warn us and tell us that that particular complication is coming and we can do something to prevent it. After therapeutics, research is another very important area. I think artificial intelligence can help us in research very much. Now, for example, when we plan any research, the first thing is to calculate the number of people to reach a certain conclusion. By knowing the prevalence of the disease in that particular area, machine can give us a quick response, and this much number needs to be studied to reach that conclusion. And machine can also tell us which geographic areas to be included and which are to be excluded for that study, because by the data machine has would know that where this disease is to be found. So interpretation of data, when doing research, we are accumulating data, and at specific intervals we analyze that data, but machine can do it in real time and can tell us if there is any possible harm of any intervention or if there is clear-cut advantage of the intervention. So that would lead to earlier termination of studies. So I think, and finally, once we collect data, machine will be able to draw conclusion very fast, much faster than humans can. Genetic background and personalized treatment. Prediction of familial diseases. There are certain diseases which run in the family. Now, artificial intelligence can predict with much more accuracy the chances of having that disease in the next child which is going to be born. So I think we can plan our families accordingly, and selection of medication on individual basis. So we have learned that there are medicine, for example, aspirin or clopidogrel. Every person does not respond to aspirin. There are people who just do not respond to aspirin, and that is because of their different metabolic and genetic background. So our genetic profiling will tell us which medicine to be prescribed to which patient, and this would also be applicable, I think, more importantly in oncology. So based on this information, we will know which chemotherapeutic agent would be best for which patient. Now, drug discovery, we still have many diseases for which there is no drugs, and also when we have drugs, we are still trying to find a better one, like antibiotics, anti-diabetics, antihypertensive. So this artificial intelligence can help us to find new drugs much faster. It takes approximately 5 years to analyze one protein molecule, and one can actually do a PhD on one single protein molecule. And you know, proteins have got a lot of therapeutic potential. And DeepMind, one of the subsidiaries of Google, based in London, has already analyzed some 200,000 protein molecules, and they have a possible role in various diseases management. So I think drug discovery is typically very slow process. With the help of artificial intelligence, it is possible that this process will become faster. Now, like for example, we have tirzepatide, which is dual GLP-1 and GIP agonist. We have another one there's another one which is triple agonist. It is called, I've forgotten the name, but that is triple agonist, GLP-1, GIP-1, GIP, and also glucagon agonist. This just didn't happen by chance. The scientists knew from the background of artificial intelligence that which molecule is to be addressed and how we can build one molecule which can address all three receptors. So I think this is how the drugs are being developed much faster according to what we want to do with the drugs. The epidemiology and predictive analysis planning will be possible. For example, if we had known about this COVID epidemic, which was developing in a limited part of the world, and if we had known 6 months earlier that this could become a pandemic, our planning would have been much better, and the way we would have handled COVID would be much more efficient. So I think planning ahead would be possible. Now, virtual health assistants, there are many things which we have to do repeatedly, and I think anything which is to be done repeatedly and machine can do at least as efficiently as we human can, but can save much time. For example, this history taking, I think machine can take a very detailed history, and it can do counseling when we make a diagnosis and we have to counsel the patient. Machine can do it at least as good as we can. It can make customized dietary advice according to the patient disease. Patients, for example, diabetes, hypertension, heart failure, gluten neuropathy. It can give you a very customized dietary advice according to your weight and your height and your gender. Customized exercise plans, appointment scheduling, and finding concerned consultants. All these are possible by making a machine as your virtual health assistant. Remote monitoring of patient with the help of AI enabled hardware, especially useful for chronic disease management. Surgical assistant, I think this is very fascinating. Surgery is very time consuming, and it requires highly trained humans, and because it is time consuming, many patients have to wait for their surgery for months and sometimes years. So if we have more efficient machines in the form of AI enabled robotics, our surgery can become much more efficient. I'll give you some examples slightly later. So machine can offer precision and accuracy, and it offers robot assisted surgery, navigation and guidance. For example, I know surgeons have to explore to find a particular organ, like patient has to make a dissection and try to find where this little parathyroid gland is. Machine can help to find it much faster. Patient specific approach. We all have slightly different anatomy. My gallbladder may be at a slightly different location than yours. So machine can help to find mine much faster. Remote surgery is also possible. Skill enhancement and training is also possible. Continuous monitoring during and after surgery machine can do. Then post-operative care also machine can do very effectively. Improved efficacy. Artificial intelligence can surely improve efficacy, as it has got limitless capacity and doesn't get tired, doesn't get sleepy. And artificial intelligence streamlines administrative tasks by reducing paperwork and improving operational efficacy. Now, half of our time goes to documentation. So machine can do that part, whereas we can spend the same time in empathy and patient counseling, which we can maybe do better. Artificial intelligence might bring the cost down also. Now, because it requires new software, new technology, you might think that this is going to be very expensive. It would probably be expensive in the beginning, but ultimately it will become cheaper. Why? Because it would be able to do much more work in the same time as human can. So I think we should look forward to as a very efficient and relatively cost-effective treatment in the future. Now let me give you some real life examples, real world examples. There are many successful AI implementation in healthcare. IBM Watson for oncology, very sophisticated software which can diagnose even the rarest possible cancer, and based on that person's profiling can guide which particular anti-cancer therapy would be best for that particular patient. PathEye is a software which is made to make the biopsy diagnosis, and it is also available and is being used very, very efficiently. Zebra Medical Vision is another software to recognize patterns used in radiology. CyberSight is software which is used for retinal diagnosis and visual problems. Google DeepMind is for protein analysis and many other things actually. And then chatbots and virtual health assistants are developed. Maybe just a computer or a computer, the looks of a robot can help you as a chatbot. If you call a hospital, it will give you the appointment, and it will also answer all your questions if you have any queries about your disease, your medication, your diet, and it will be able to offer you that facility. Da Vinci surgical system. I saw the video, and I was really fascinated, but I'm afraid I will not be able to share that video here because it is taken from the internet, and I fear my own video might be then taken as a violation of copyright. But this is the video, just a glimpse I will show you, and they have shown how precisely they can peel off a grape. Before watching this video, I didn't even know that grapes can be peeled off. But if you are really interested to watch this video, this is the link and you can watch online. And you will be surprised how accurately and precise AI-enabled robotic surgery can do this procedure. And from that, you can imagine how accurately this system can remove a deep-seated metastatic lesion in the liver, or can remove a small lesion deep in the lungs. So I think this surgery, the robotic surgery, is really going to improve the surgical skills. Now this is another real life case in response to my query regarding a real patient. This is what ChatGPT said. Now ChatGPT is also a form of artificial intelligence, and you might not be able to read through this text. Now let's ask the machine to read it for us. Now this is going to be a machine read. Now see how human-like this is. Now I'm going to ask machine to read this text for you.
Based on the laboratory findings and symptoms mentioned, the patient may be suffering from hemolytic anemia. Hemolytic anemia is a condition characterized by the destruction of red blood cells, leading to low red blood cell count and consequent symptoms such as severe anemia and jaundice. The high unconjugated bilirubin level, low haptoglobin level, and elevated LDH indicate hemolysis, while the normal ALT/AST values and negative Coombs direct test exclude liver disease and immune-mediated hemolysis. The presence of hypochromic microcytosis suggests iron deficiency anemia, while the high ferritin levels could be due to an inflammatory response. The mild hepatosplenomegaly may be due to hemolysis or underlying chronic liver disease. Therefore, the diagnosis is likely to be hemolytic anemia with a possible underlying cause of iron deficiency anemia and chronic inflammation. Further investigations such as respiratory count, serum haptoglobin, and genetic testing may be required to confirm the diagnosis and identify the underlying cause.
See how correctly this paragraph is written, properly paragraphed and capitalized, and punctuation, everything is correctly placed, and this response is very much like a human. So I think machine can help us to make lectures, to make presentation. I can even lend my voice. The various voices are available. I could actually lend my voice to the machine, and the same would be read in my accent, and it could be presented. Future possibilities, the role of AI in health is enormous, and it is definitely going to be there. Now, but there are some issues, potential concerns and challenges. I'm going to very briefly mention because this lecture is getting fairly long. ethical considerations, privacy and security concerns, and implementation. In implementation, there are going to be some issues because we all tend to avoid change. We resist change, but I think we would definitely ultimately need to change. Now, these are some of the concerns. Ethical and regulatory compliance is going to become an issue in implementation. Algorithm bias and fairness. An algorithm developed in the other end of the world may not be directly applicable to our part. Validation and clinical acceptance. Of course, whatever machine tells us is what the machine learned from us. We have to put in the right information. So I think that needs to be done. Cost and resource constraints, integration with existing workflows. Some people are threatened to become jobless by machine. So I think that needs to be taken care of. Lack of standardization, education and training, and patient trust and consent. So this is another important. The patient might not trust machines judgment. So I think I think with time probably they will start trusting machine. Then regulatory hurdles, maintenance and updates. These are some of the issues which will become obstacle in real implementation of AI in healthcare. So, ladies and gentlemen, let me conclude my talk by saying artificial intelligence has got great potential in health. For example, in diagnosis, in management, in monitoring, administration, drug discoveries, research and surgeries. So practically every area of healthcare there is role of artificial intelligence. It will surely have some teething problems, but surely will outgrow them, and ultimately we will have much better form of artificial intelligence that we have today. And future healthcare will be very different because it will be mostly this AI enabled. So is AI going to replace us as doctors? So this is very important question. I will end my talk by giving this quote by Charles Darwin. It is not the strongest of the species that survive, nor the most intelligent that survives. It is the one that is most adaptable to change. So let's change and adopt AI. This is inevitable. Thank you.